Wake up. It's the Sleep Unplugged podcast, episode 122, Bedwetting, Golden Slumbers. Welcome, everyone, to the Sleep Unplugged podcast. My name is Chris Winter. I'm a neurologist and sleep specialist and your host for this episode of the podcast. If you're new to the Sleep Unplugged podcast, welcome. If you are a veteran, welcome back. We're glad you're here. It's been a busy week. Before we get started, if you want to contact the show or get in touch with me, you can through social media. That's Dr. Chris Winter, Instagram, Dr. Chris Winter, Twitter. We have a YouTube page where we post all the content, video content of our show. And if you're a follower of the show, you know that we always reference a song in the title of our podcast, and we'll put that on the Spotify music playlist. We are on volume 3. Busy week. Want to give a shout out. As you can see, if you're watching the YouTube page, I'm wearing my Dodgers shirt because last night they punched their ticket to the World Series. Unfortunately, my other team that was in the mix, the Cleveland Guardians, did not. But wow, did you see that game where they beat the Yankees with the late 2-run blast to send it into extra innings, and then the walk-off home run? That was electric and exciting. And unfortunately, the Guardians just could not compete with the firepower and, let's face it, the money that the Yankees have spent on this team, but does not diminish a fantastic season and just an amazing organization that I love dearly. So busy week. The reason this podcast is a little delayed in its publication is that I was helping my son move from the Naval Academy in Annapolis down to Pensacola base, where he will begin his aviation training. And the move went, it was hell. It was, it was a long trip dragging a trailer and trying to be careful because his car, we determined, was not necessarily rated to pull a trailer, even though it was an SUV. We didn't know that. So we really took our time to get down to Florida. And then I was supposed to fly back yesterday, Sunday, and record the podcast, and my Breeze flight was canceled. So I quickly dashed down, rented a car, and drove the 7 hours from Pensacola back to Sarasota, where I am right now. So bit of an adventure. So didn't get quite the podcast recorded the way I wanted to. So sorry for the delay. We typically do comments, corrections, criticisms at the top of the show, but I'm going to make an announcement. So we're going to forego that. And the announcement is our producer. If you listen to the show, my daughter, Maeve Winter, is the producer and was a big inspiration in terms of getting this up and running. She is a grad student up in Columbia, but one of the things she's really interested in is she works and teaches at Integral Yoga Institute in New York. And she recently got, completely certified to do her instructions. And she is offering, as sort of a crossover kind of event, a 75-minute level 1 hatha yoga class that is intentionally designed to move at a slower pace and intentionally designed and tailored to be done in the evening as sort of a preparation for sleep. So if you are a listener to the podcast, we did episode 57 was how beneficial yoga can be for sleep. 2 episodes later, episode 59 was about the importance of establishing good bedtime rituals. And this class is really the crossover. It is a yoga class that is virtual. So you log in, you'll do that in your own home. In the evening, the class starts at 7:45, will end at 9, and it's intentionally designed to kind of get ready for sleep. So she wrote and said, just, tell our listeners, while it follows the traditional integral yoga level 1 structure, the asanas, the poses will focus on overall pacing to emphasize unwinding and preparing both the body and mind for rest and sleep. She wrote, "My goal is to create a restorative, comfortable, and easeful experience that makes your Monday nights more peaceful while still offering a complete yoga practice, including yoga postures, deep relaxation, breath work, and a brief meditation." So she intentionally chose Monday because you wake up, you've had your weekend, you go to bed Sunday, you wake up Monday. Of course, you listen to the Sleep Unplugged podcast if Chris can get it together and get it published on time. But Mondays can be very stressful for people. They kind of start the week off. You go from this relaxing weekend to a stressful week. And so she intentionally chose Monday nights to be this class to sort of start your week off in a way that really supports peace and rest and sleep. I hope everyone will join me. I'll be in the class for sure tonight. You can find the class. It's IYINY. So Integral Yoga Institute, New York, IYINY.org/classes. So if you look it up, scroll down there, you'll see Level 1 online. The instructor is Maeve Winter. The cost of the class, I believe, is $27. It's 7:45 to 9 o'clock. Great deal. And I'll look forward to hearing from you. If you do it, how does it impact your sleep? And I'll give you my feedback about it. I need a yoga class bad because I have been driving between the evacuation from the hurricane and this move and the unexpected 7-hour drive late last night to get home, so I could see my patients. I am ready for some yoga. So our musical group this week, Golden Slumbers, is of course a Beatles song. We covered the Beatles a while back on the show. They were the group we talked about in episode 55. So I thought instead I could focus on two other artists. One is Dua Lipa, the fantastic Albanian British artist who I really like her music, sort of more of a dance kind of mentality with her music, wildly successful. So back in 2017, she released digitally a live acoustic album and does a fantastic rendition of Golden Slumbers. And Golden Slumbers was written by the Beatles. It was based upon an old lullaby. So during the sessions, Paul kind of had this idea for the song and kind of noodled around with it and recorded it. Actually, when he recorded it, John Lennon was not there because he had been recently injured in an automobile accident. So it's just Paul, George, and Ringo on the song. Uh, Really quickly, one of my favorite versions of this song was from 2010 when Paul McCartney was honored at the Kennedy Center honors. You have all the people, Gwen Stefani, I believe Mavis Stapleton, who I love, kind of closed out the tribute. But one of the artists that sang was Steven Tyler of Aerosmith, and he performed a dynamite version of Golden Slumbers that you can find on YouTube if you look it up. So while you're looking up the YouTube Sleep Unplugged podcast, you can look up Steven Tyler Golden Slumbers from the 2000 Kennedy Center Awards. Just a really different feel for the stuff you kind of associate with Steven Tyler, who was a very close friend and big fan of the Beatles. So Golden Slumbers, we'll put the Dua Lipa version on there. We'll certainly put the original on the Spotify music playlist. And if I can find the Steven Tyler version on Spotify, we'll put that on there too, but I'm not going to hold my breath on that one. So Enuresis, this is a topic we've been kind of circling around a little bit, bedwetting. We've talked about it in other episodes, but I've not yet put it on the playlist. And I thought, um, given the fact that it's a big concern for a lot of parents and also for adults. I want to talk about adult enuresis briefly too. I thought this would be a very logical podcast episode. So, what is enuresis? Enuresis is really it's bedwetting or involuntary loss of bladder control. Enuresis generally, so when we talk about what we're talking about in this podcast, we're really specifically talking about nocturnal enuresis, where a child who is not able to control their bladder is urinating in their clothes or in the bed. It can occur during the day. It can occur during at night. So it can occur during naps. It can occur, just when kids are sleeping at night. So there can be, both of those things can happen, or you can just have nocturnal enuresis where they're staying dry when they nap during the day. Generally, bedwetting before age 7 is not a big concern, and that varies a lot. So I get to see individuals, obviously, in whom the enuresis is continuing to be a problem. So in our clinic, we see both adults and kids. I will say I've seen some kids who are quite old, and I always ask, okay, you're here. How did you get here? What does your pediatrician think about this? The vast majority of people that I've seen, and again, this is not a scientific study, this is an observation, there's often a real nonchalance, kind of nonchalant attitude towards the enuresis. The 8-year-old, the 10-year-old, the 11-year-old is struggling with enuresis. And from my perspective, and I'm getting this from the parent, there doesn't seem to be a lot of urgency from the pediatrician a lot of times. There's sort of he or she, they'll grow out of it, is sort of the common refrain. So that sort of begs the question, what does the incidence of enuresis sort of look like as we move up in age? So most kids are generally fully potty trained by around the age of 5, but that doesn't mean that all kids have bladder control by that time. And sometimes asking about parental bedwetting or enuresis can be helpful in terms of, mom or dad were late to potty train. That might be an indication that there's, sort of a delayed maturation happening, and that's being passed down to the child. Between the age of 5 and 7, bedwetting can remain a problem for some children. Again, after the age of 7, only a small number of kids still wet the bed. Small, relatively speaking. There was a 2019 study that found that enuresis is a common complaint in children with the prevalence of around 15% at age 6. So that's not an insignificant number. 15 out of 100 kids at age 6 are still having trouble. After that time, the number does go down pretty quickly. So there are ways that we can classify enuresis, and those are important because they can help diagnostically. One is primary enuresis. My child or older child or adult never gained the control of their bladder at night. So they've had enuresis solidly throughout. There's also secondary enuresis where my child did potty train and was dry for some sort of period of time, and now the enuresis has come back. That is called secondary enuresis. There's also another classification that if you're, looking into enuresis, you may come across, which is monosymptomatic enuresis and non-monosymptomatic enuresis. Monosymptomatic enuresis, also known as nocturnal enuresis, is when the child is wetting the bed at night, but throughout the day has normal urination. Non-monosymptomatic enuresis, sometimes it's shortened as NMNE, is when the child has bedwetting at night and other symptoms during the day, such as daytime incontinence, frequency, which means they're going to the bathroom a lot, urgency, they're feeling the need to go to the bathroom, which may result in urination or not. So sometimes urgency, it's a common complaint with women who have a UTI. They have a sense of urgency, like I've got to go to the bathroom. So they go to the bathroom and they don't urinate. And then dribbling, which I think we can skip that definition. I think most people know what dribbling would be. So who's at risk for enuresis? We mentioned familial. It can be there can be a family history of enuresis, particularly if both of the child's parents had difficulty with that. Their child will probably have an increased risk of wetting the bed too. The condition is twice as common in boys as it is in girls. Stress and anxiety can play a big role. Sometimes children with enuresis kind of have a sort of a nervous or anxious personality, which certainly the enuresis as you get older is not helping that situation at all. Stressful events can trigger bedwetting, including having a new baby in the family. There's that kind of regression that can sometimes happen with children. So that's often, again, that secondary enuresis. My son was fine, potty trained around 5. Around 7, we got a new baby in the house, and he started wetting the bed again. The other one that's really big is starting school. There's always a flurry of enuresis activity around school start, school starting and the anxiety of moving up a grade or starting school to begin with. And then also sleeping away from home. And that's the traditional thing we all think about. Sleepaway camp at, the canoeing, archery, outdoors camp somewhere in North Carolina that your parents went to when they were little, and by God, you're going to go to it too because I made friends that I've kept for a lifetime there, and I had the biggest crush on my counselor. That whole situation. So you go down there, and you're in the top bunk, of course, and you wet the bed. Um, and it's embarrassing because your pajamas are wet and you're in the bunk and you're in your sleeping bag is wet. So it's kind of that sort of thought that's portrayed often in movies, I think. The other thing that can be a risk factor for bedwetting is ADHD is much more common in kids who have enuresis is much more common in kids who have ADHD than kids who don't. Obesity is sometimes cited as a risk factor as well too. So when we think about causes, it is helpful to go back to primary, secondary. What would cause enuresis to occur where you never gain the ability to control your bladder versus what is causing the issue when you have gained the ability to control your bladder, go for a period of time of being dry at night, and then now you're going back to wetting the bed again. So when we think about primary enuresis, you never gain the ability to stay dry at night. Small bladder, so anatomical issues, which makes sense. If you're born with a small bladder, if you're born with weak muscles, sphincter muscles, those things may or may not change as you get older. So your child's bladder may simply not be developed enough to hold urine that's being made during the night. Now, that can change over time, but if you're saying to me, my child has never been dry, time may make that better. So the pediatrician might be right. Hey, just give it time, hang in there. Everybody's bladder maturation is on a different schedule, so all hope is not lost here. Um, the second is has nothing to do with the actual bladder, but the signal our bladder is giving us to let us know we need to void. Um, and so they don't have the awareness of the full bladder. So the nerves that control that are slow to mature. The full bladder is not waking your child. It can be really true if your child is more of a deep sleeper. You're sleeping through that impulse. And, one of the things we've talked about, I think, or I talk about with my patients who are being put on oxybate therapy for narcolepsy, which can change the depth of somebody's sleep dramatically. We think about narcolepsy as state instability. They are waking up a lot during the night when they sleep. They're sleeping a lot during the day when they wake. Their state of being either awake or sleep is unstable. This can radically change that and make the stability of their sleep at night much more stable, which increases more deep sleep, which is why they typically feel better the next day. They can have bedwetting. If you look at oxybate, one of its side effects can be bedwetting, and I've seen it sporadically. It's usually one and done, but it certainly can happen. So if you can't perceive that your bladder is full, which is usually a really strong impulse, I'll never forget. I was in New York giving a lecture, and I was like, "Great, okay, lecture's done. I'm going to walk to the. I think I went to I went to the Museum of Modern Art because they had a really cool exhibit I wanted to see and walked around there. And I left and I was walking quite a distance back to my hotel, but I love to walk around when I'm in the city. And as I left the museum, I was like, oh, I should have gone to the bathroom. I kind of have to go to the bathroom, but it's okay. I'll make it. And I just radically underestimated both the distance and my body's need to go to the bathroom. And I have never been in such pain and discomfort in my life. Was in a part of town where there wasn't a really easy bathroom. And at one point, I was like, I'm going to lose this battle if I don't do something. So I just went into another hotel that I wasn't staying at, just praying that there was some sort of bathroom in the lobby. So I just kind of walked in as nonchalant as one can when you feel like your kidney is going to explode in your lower back. And there was a bathroom there, but there was a lock on it. So I was going to have to use like a key card, and right beside it was a potted plant. I'm not going to say what I was thinking about when I saw that potted plant. I will leave that up to you to imagine. But I just tried the door, and by some miracle, it opened. I was on the verge of passing out from pain based upon what I was feeling prior to relieving my bladder. So, this is a feeling that can be dramatic when your bladder is full. And for some people, that doesn't register. And that can be a big problem when it comes to enuresis. Now, the final one, when you think about primary, is hormone imbalance. So during childhood, some kids are just not producing enough of a chemical called anti-diuretic hormone, sometimes abbreviated ADA. So you can imagine a hormone that's diuretic would make you go to the bathroom. We make a chemical called anti-diuretic hormone that allows us to not urinate, to not even, to not produce urine at a certain, rate. So ADH slows down how much urine is made during the night naturally. So if you don't make that, the urine production doesn't have that diurnal variation. It's not changing from day to night, and that can be a cause. So let's switch gears quickly to secondary causes of enuresis. And now we're starting to get into more detective work in terms of, okay, you were dry for a period of time. Now you're not. What could be going on? UTIs or urinary tract infections can be a cause. They increase the urgency and urge to pass urine. Symptoms can include bedwetting, daytime accidents, passing urine very often. And sometimes the urine has a funny smell. It can be discolored, slightly reddish or pinkish at times. And then there's pain sometimes that accompanies both prior to urination, but the active urination can be painful as well too. Why is a sleep doctor talking about enuresis? This is urology, not necessarily neurology. Well, it is kind of neurology because the brain controls that antidiuretic hormone. It is receiving the impulse from the bladder. Well, why? Okay, great. So neurology, sure. But what about a sleep doctor? Why would a sleep doctor care besides the fact that it's occurring at night? Well, a lot of sleep disorders can result in enuresis. In fact, when I talk to kids who are struggling with their sleep, I always ask, how do you do in school? Do you snore? What is your behavior, attention, concentration? What is that like during the day? And do you wet the bed? And that's always a surprising question to ask a kid. It's always surprising to ask a parent because things like sleep apnea can cause bedwetting. So it's shocking to parents and still kind of surprising and exciting to me that when you've got a child who's got sleep apnea and you do something to treat the apnea, let's say take their tonsils out, and as soon as you take the tonsils out, the bedwetting stops because that interruption to sleep, that breathing disturbance was the cause the whole time. So sleep apnea is when child's breathing is interrupted. It's usually big tonsils or some sort of airway obstruction that's happening. So we see a lot of young people with enuresis to make sure that there's not sleep apnea or some underlying sleep problem. Any sleep disorder could potentially cause enuresis, but sleep apnea is probably king when it comes to that. Diabetes can be a cause. So, checking the urine for, ketones and child sugar and things of that nature. Doing an evaluation for diabetes is really important. Constipation is another one that some kids sort of deal with. So, ongoing constipation, kids who don't have particularly frequent bowel movements, their stools are hard and dry when they come out. When constipation is sort of long term, the muscles involved in passing urine and passing stools may not be working well. So, that needs to be kind of evaluated because it can be associated with bedwetting. And then obviously there is a urological evaluation that's urological with a U that often it happens with some kids if enuresis is prolonged to make sure that the pathway between making the kidneys and the passing of the filtered fluid from the kidney to the bladder, from the bladder out of the body, that entire process and passageway is healthy and normal. Um, and so I think, seeing the urologist is really important. And again, urology with a U, it's funny. I'm a neurologist. And one time when I was a chief resident, I got a call one night because people mistake when you hear urology, neurology, they kind of sound the same, especially if it kind of an accent like mine. And so I got a call one night when I was on call, when I was in my training as a neurologist with an N, where a young resident, I was an older resident at the time, said, "Hey, we're having trouble passing a Foley catheter on this patient." So the Foley catheter is what you would insert into in this case, a man's penis to alleviate, to get urine out of the bladder because it was an obstruction. And so I was like, why is this person calling me about having trouble putting a Foley catheter? And I realized, oh, they called the operator, said I need the chief urologist, and they put it through the chief neurologist. So I said, well, if you push the catheter, does the patient lose the ability to speak? And they said no. And they seemed very confused. Like it was some intern. It's like, no, no, they don't. No, they're not losing the ability to speak. I said, okay, that's good. Now, if you push the catheter and you hit that blockage, does the patient suddenly have trouble using their left arm? And he was like, no, not at all. Why are you asking me these questions? I said, well, I'm the chief neurologist, and I'm just making sure you haven't pushed that Foley catheter so far into your patient that the catheter is poking their brain because I have no idea to help you with the situation. So I would see that intern from time to time, and he always laughed when he saw me. So that's my urology neurology joke. In terms of treating this, there are a lot of treatments. And I think that the first one we want to talk about is there are medications. And so a lot of times there's a chemical desmopressin, which is a little tablet that you can take, and that allows individuals, particularly with monosymptomatic enuresis, to help with that accumulation of fluid during the night. Also, drugs that are anticholinergic, so that tends to kind of create sort of a urinary hesitancy and prevents the flow of urine. So medications can be helpful in these individuals. The anticholinergic, particularly for individuals with non-monosymptomatic enuresis. For refractory cases, I think it's really important for individuals to see a urologist. There was a 2005 Scandinavian paper that looked at 38 studies. So it was kind of a review of all these studies looking at the treatment of enuresis. And the criteria was something like you had to be wet at least 3 times a week, or at the inclusion, and success was having at least 14 consecutive dry nights. And basically said that, all comers, the success rate in terms of treating enuresis was somewhere between 30 to 87%. But if you really looked at people who were pretty disciplined about the treatment in 20 studies, it was about a 65% improvement. And one of the doctors, the specialist I used to work with at the University of Virginia, was sort of an enuresis specialist. There are cognitive behavioral therapy modules that you can do. He was a very, very big proponent with enuresis alarms. So an enuresis alarm is something an individual wears at night. It's like a little pad on the bed. And as soon as it gets a single drop of fluid on it, an alarm goes off and starts blaring and kind of creates a big noise, and the patient kind of wakes up um, and it allows you to kind of train the person to use the bathroom. They are difficult to use. They involve the whole family. So if you've got other kids, these alarms are loud and you have to be very disciplined with them. So I spent some time with this guy's Enuresis clinic, and there's so many parents who are like, I got the alarm. We tried it 2 nights. We hated it. We stopped. In order for these alarms to work, and they do, they have a very high success rate. You have to be very disciplined about using them. So Enuresis alarms can certainly be out there. I just want to mention really quickly adult enuresis, also known as bedwetting in adults. Very uncommon, 1 to 2% of the adult population. But as a sleep specialist, I see a fair amount of those people. Can be caused by medications. All the same things we talked about with secondary enuresis with kids can be causes of it in adults. And an adult can have primary enuresis, meaning that some sort of anatomical problem has prevented them from ever being dry at night. So that can certainly be helpful. Limiting fluid intake at night, trying to create a regular voiding schedule during the day. There are bladder exercises that can be helpful. I am not in favor of limiting fluid during the day if you wake up once or twice a night to go to the bathroom, where you're waking up, go to the bathroom, go back to bed. I think that's ridiculous. Now, bedwetting, I think, is a very different thing, where if you're waking up having wet the bed, limiting fluid intake can make sense. We've talked about desmopressin. It's also called DDAVP. That can be a standard treatment for as well. So making sure you're talking to a doctor. I wanted to do this podcast to understand that I see enuresis a lot, not only in kids, but adults. So I don't want people to be embarrassed. It happens. People snore, people wet the bed, people sleepwalk, they sleep talk, they do all kinds of things in their sleep. So if you're having enuresis, you're not alone. Don't be embarrassed. Talk to a doctor about it. And we've had patients who wet the bed during sleep studies. It's just nobody even blinks. It's like if you're like, well, what did you talk about the next day? We talked about all kinds of things the next day when the staff got together. We did not talk about your enuresis because we see it all the time. It's just not something that really registers with us. So people urinate. Some people have trouble controlling the urinate. It's nothing for you to be embarrassed about. Please reach out and talk to a sleep specialist or your urologist to get help for it. So that's it. Sleep enuresis, bedwetting, done and dusted. If you have questions, comments, corrections, criticisms, please get in touch with us at Dr. Chris Winter. We love Twitter and Instagram. We love reviews of the show. Follow us on our YouTube page. Follow the Spotify music playlist. I hope to see everybody at the Integral Yoga Institute 75-minute sleep yoga meditation that happens at 7:45 tonight. Register at iyiny.org. And until next week, sleep well.